Let's talk about COVID-19 at-home testing. First, who should do a test? Anyone who has had an exposure or who is having symptoms should absolutely consider trying to get and do a rapid at-home test. When should you do a test? Before a social gathering? Great time to consider doing it. There's no magic or official recommendation as to timing. 1 hour prior to that gathering is a good and reasonable time. Those rapid at-home tests give results in 15 to 20 minutes. Certainly before or after traveling is also a good idea. Either immediately before traveling or several days after traveling. Again, no official recommendation as to when this is. There's kind of a window of acceptable time. And what about testing after an exposure? If you've been notified that you've had a close contact of someone with confirmed COVID-19, the recommendations at this time from the CDC are that you get tested with either a rapid at-home test or a PCR on day 5, 6, or 7 after exposure. There is early data that suggests, specifically with Omicron variant, that the rapid at-home test can continue to show a negative even when someone is having symptoms or symptomatic. So the recommendation is for someone who's been exposed or having symptoms, if you get a negative result with a rapid at-home test, remember these are rapid antigen tests, then you should repeat that test in 24, 36, or 48 hours. These rapid at-home tests are really designed to be done serially. So it's not that we hang our hat on any one result at one point in time for the most part, especially when you're talking about a rapid at-home test that gives a negative result. What if you get a positive result on a rapid at-home test and you are having symptoms? If you get a positive result on a rapid at-home test and you are having symptoms, assume that is a true positive. Right now, these tests are ranging around 90% accuracy. They are much more accurate than they were in the beginning of the pandemic. There is no official need to confirm that with a PCR, even though PCRs are our diagnostic gold standard, and PCRs are reportable in terms of their results so that we can track and analyze data. There's no obligation from a medical standpoint, especially if you're not feeling well or if you have difficulty logistically accessing a PCR test. There's no absolute obligation to do so. Also in the news recently is the question about what body part you're actually swabbing with these rapid at-home tests. We've heard people doing throat swabs. At this time, the rapid antigen at-home tests are designed as nasal swabs and nasal swabs only. They don't have to go all the way back in the nasal pharynx like they used to in 2020. So you just want to insert the swab into your nostril, twirl it around at least 5 times to make sure that it actually touches the side of your nostril, and do that in both nostrils. Do not take a test that's designed for the nose and use it in the throat. That can affect the accuracy of the results.